As you know, majority of my patients belong to my age group, which is Gen X. So one of the most common concerns I get asked during consultation is, Marie, what can I do with my jowls? So first things first, my direct answer is if there's severe jowling and if budget is not a concern and you're doing more of this, then your best bang for your buck is really to just get a surgery, all right? So that the effects are more long lasting. However, majority of my patients are not really ready for surgery and they're not really looking to look like they're 25 or even 30. We just want to look good for age, right? So depending on assessment, there are different ways that I could minimize the jowl. One more time, minimize but not magically disappearing. Okay, we don't perform miracles, although my patient would say, Marie, you are a miracle worker. Well, I appreciate that. Let's cut to the chase. So if I see that you would benefit more with strengthening the skin, especially if you have laxity, and take note, jowling is a result of multifactorial causes of aging. So there could be bone resorption, there is loss of collagen, loss of volume. So we need to be able to address those different factors for the most part in order to get the optimal results. So say for example, I see that you have a lot of skin laxity, then I could start you with a biostimulator, and my favorite is hyperthermic radius because I've seen phenomenal results with myself and for all of my patients that I did hyperthermic radius. In a nutshell, it stimulates collagen in hyperthermic or dilute form, and injected in the right lane, it stimulates collagen formation, right? So collagen 1 and 3. Collagen 1 for structure, 3 for elastin. That's how you will remember that. Now, another thing is also consider doing talks. Botox, there are different brands in the US market. Those just right, again, case to case, that can actually reduce the appearance of the jowl of what we call the lower face depressor muscle, aka platysma. So where do we inject that? Along the mandible. And if you're like me, where in your platysma bands are also strong, then we could also relax that. And by doing such, we're able to create, again, minimize the appearance of the jowling. So I inject along the mandible in the bands. Now, if I see that your neck is also wrinkly, then I might also add, aside from targeting the bands, I would also inject intradermally in order to really make your neck looking a little bit more smoother. Now, I have patients that are not really that old yet, and when I mean not that old, my age group again, alright? Sometimes they want a snatched look, so I revert to my other modality, which is dermal filler. That's why you see a lot of my before and after photos utilizing dermal fillers in the lower face. I have a lot of experience doing that, and it's really not just face changing and life changing in some ways, because with a new rejuvenated look but still looking natural, that actually increases our confidence. Now, to know whether you're a good candidate for any of these treatments that I said, the best is book an appointment online. When you call and you ask for pricing, I wouldn't even know because I don't have x-ray vision. I need to touch your face, I need to observe and just get an overall profile, because I tell you, when you book an appointment and we will discuss your goals and we'll be able to really prepare a realistic treatment plan.